name is Dr. Gopal. I'm one of the GP partners at the Beaches Medical Centre, and today I'd like to thank you for giving a few moments of your time to listen to this message, which I feel is very important. The message I want to give you today is about diabetes and pre-diabetes. This is important because some of you in the coming days to weeks might be getting a message or this video from the surgery informing them that their blood test is in the pre-diabetic range. First of all, what is diabetes? As we know, there are two types of diabetes, type 1 and type 2. Type 1 is not linked with age or being overweight. The causes are generally unknown and it is unpreventable. And as we know, in general, a type 1 diabetic patient would need insulin. However, the diabetes I want to talk to you about today is type 2, which is much more common. It's normally linked to lifestyle factors and develops over time. So in general, you see that people who are older have a higher chance of developing type 2 diabetes. The thing about type 2 diabetes is it is preventable, and that's why I want to talk to you on this. When you become a type 2 diabetic, your body stops producing enough insulin, or your body cells stop reacting to insulin, and that's what causes your sugar levels to remain high. This means that the sugar levels in your body are too high, and as a consequence, various organs of your body can be affected. For example, your eyes, your heart, your kidneys, and even the blood supply through the arteries to your limbs. And I'm sure many of you may have seen people with complications. So when you become a type 2 diabetic, your body stops producing enough insulin, or your body's cells stop reacting to insulin. And if not treated properly, almost every part of the body can lead to serious health problems, as I just mentioned. For example, blindness, heart attacks, stroke, and even amputations. Keeping this in mind, you may have received the result of your blood test for your sugar levels checked with us. If you are 48 and above in terms of your blood test result, it could mean that you are diabetic. And quite often we might ask you to recheck your blood test in 2 or 3 weeks to confirm it. Do not lose hope, because if you are diabetic, we would ask you to see our nurses so we can start you on treatment and give you guidance. The other area which I want to talk to you about is pre-diabetes. That means if your blood test lies between 42 to 47. What it means is that you are not diabetic, but if you do not pay attention to all the preventable factors, you run a very high chance of turning into a diabetic with all the risks as I outlined. The thing about pre-diabetes is that it is reversible. You can act on it. If you are overweight and at high risk, just losing 5% of your body weight can significantly reduce your risk. And we ask you to contact the surgery because we might be able to guide you on to Slimming World, or referring you to other agencies that help with weight loss. We can recommend you reducing your intake of sugar-sweetened drinks, for example, colas and fizzy drinks, reducing your intake of red and processed meats, and also reducing your intake of processed carbohydrates like white bread, sugary snacks, and sugary cereals, etc. And particularly foods which are high in carbohydrates, for example, potatoes in the form of French fries. As I said, lifestyle factors can contribute to type 2 diabetes and pre-diabetes, and being more active can reduce your risk. For this, we are in partnership with the Active Norfolk, which is the active partnership for getting people to move about in Norfolk. If you go online, there's the Healthier You, which is the diabetes prevention program, which you can use to assess your risk and also find out solutions what may suit you. To help you with the lifestyle factors where you might feel you're struggling, if you've given a diagnosis of prediabetes, it might be helpful to book an appointment to see or speak to one of our health and well-being coaches. And if you are pre-diabetic, I would advise you, in addition to all these lifestyle hacks, to make sure that you have your blood test for your sugars taken at least once a year. Just remember, help is at hand if you are pre-diabetic. It is something that you can do and act on to reverse the chances of becoming a diabetic. Thank you for listening.